I sort of went along to my local park run and I connected with people and I made friends. So for me, the social connection side and the physical activity side go hand in hand. And now it's something that I don't like missing.
Okay, and welcome to another episode of Be an Awesome GP, where we look at how to do general practice even better. Today, I am very excited to be joined by Dr. Michelle Redford. Now, Dr. Michelle Redford is coming on to talk to us about Parkrun. She's a GP at Blackbutt Doctors Surgery in New Lambton and has an advisory role within Hunter New England Central Coast Primary Health Network. She's a certified health informatician and an advocate for the use of clinical data to inform quality improvement in primary care. Michelle has a long-standing interest in the management of long-term conditions, complexity, and multi-morbidity in general practice. Michelle is passionate about social prescribing and has a volunteer role with Parkrun Australia's to empower healthcare professionals to prescribe Parkrun to their patients. Welcome to the show, Michelle.
Thanks, Chris. That's quite the introduction. Thanks for having me. Delighted to be here.
Well, if you've got the qualifications, we might as well recognise them. So I think that's a very nice set of qualifications, and I'm very excited to chat about Parkrun. Why don't you tell me briefly what Parkrun is?
Yeah, thanks, Chris. So Parkrun is a health and wellbeing organisation these days. It may have started off as a bit of a sort of fun run type organisation, but nowadays it's a health and wellbeing organisation that delivers free weekly community events in about 2,200 locations around the world every Saturday morning, giving people the opportunity to walk, run or roll 5 kilometres in a supported environment, or come along and volunteer, or just come along for a chat and a coffee and get some social connection.
Lovely. Because I would consider myself a Parkrun casual. One of the things I did really like about Parkrun was I did a lot of rural work, and even when I was traveling around, there would usually be a Parkrun somewhere nearby that I could join. And I found that a really nice way to sort of meet the community. And I think the diversity of where you guys are working out of now is really good. Tell me about volunteering, because that's a really important part of Parkrun.
Yeah, thanks. And I think that goes back to your point about Parkrun being a resource for the community. And there definitely is now a focus on starting new Parkruns in areas where they're more needed. So particularly focusing on areas of socioeconomic deprivation. So there are Parkruns in all sorts of places that you may not expect to find one. And volunteering opportunities abound at Parkrun. There are lots of easy and free opportunities to get involved by volunteering. And the research that is going on is really looking at the health benefits of volunteering. So Parkrun has a research board based out of Sheffield Hallam University in the UK, although it looks at things from a global perspective. It's based in the UK, and runs these sort of big surveys of parkrunners where it becomes clear that volunteering at Parkrun helps people feel healthier and happier, and even improves their levels of physical activity. So in a world where 1 in 5 Australians report feeling lonely or very lonely in the past week, if you talk to the AIHW, that's the figures, and that's been consistent over the past 20 years. The other thing that we need is social connection. And so volunteering at Parkrun can be an opportunity to get to know people and be part of your local community. So I'm all for it as a GP.
And that makes so much sense to me. A lot of there's a lot of my patients are blokes over 30, and they have this real pandemic of loneliness, and these blokes who might not be able to play sport anymore, but I reckon they could run up to 5K or even walk it if they needed. And I honestly hadn't considered as much the volunteering aspect, but again, that makes so much sense. So I'm very about that. I often prescribe Parkrun for my patients, but I might add in the volunteering aspect. That's really good. Tell me about...
Sorry.
No, you go. So tell me about you. Do you Parkrun? Are you a park runner? How did you come to it?
Yeah, I'm a Parkrun tragic, full-blown Parkrun tragic. So, but I was never a runner when I was younger. I started running to try and catch up with my then 5-year-old, and I did the kind of traditional couch to 5K, and he's still keen on running. But we've moved on a bit since then. He's a proper adult now. I did the couch to 5K, and then I sort of thought, well, I'll go to this thing parkrun and I'll see if I can run it. But at that time, that's a long time ago, walkers weren't encouraged in the same way that they are now. Now 15% of our event, 15% of participants at Parkrun Australia events are walkers. So so that was how I got into parkrun. That was back in the UK, and then I moved here. And I was working full-time because I'm an international medical graduate, and you have to work full-time for your visa and all of that. And all of these things. And I sort of went along to my local parkrun, and I connected with people and I made friends. So for me, the social connection side and the physical activity side go hand in hand. And now it's something that I don't like missing. So, and I enjoy volunteering, and I enjoy walking and running, and have a whole group of friends there. And that's something that I would like other people to be able to access as well.
So could you give us any tips? As we know, we can recommend something, but someone won't always do it. And that's a whole nother talk. But when you prescribe parkrun for a patient, do you give them something physically written down? Do you just verbally advise them? How do you optimize the number of people following that advice?
I think it's like anything. You have to sort of tailor it to the person in front of you, don't you? And I think we all have skills in motivational interviewing. And so it's trying to find that, that hook or that thing that is going to help people and use that. We're also sort of aware of some of the barriers to attending parkrun, because we've got research on that as well. So some of the barriers are things like not feeling fit enough, or not wanting to go on your own, or not wanting to come last. And so just exploring those. Yeah, so no one's ever going to come last at parkrun, because there's a tail walker who's a volunteer who comes last. So there's no time limit. So you're not going to be last. And so those things, just talking through those, exploring those, can be really helpful. And then getting people to then identify, specifically where would they go, and how, would they go with someone? All of that kind of planning stuff. A bit like when you're prescribing medication and you've got to give instructions, I don't think necessarily, like sometimes people are motivated and keen, it's enough to just signpost. But I think if you're really truly prescribing, you have to have an understanding of what you're prescribing. And that's where the Parkrun Practices Initiative comes in, the RACGP Parkrun Practices Initiative. So that's where we're encouraging individual GPs or practices to kind of go along to their local parkrun, see how it all works, meet the team. So they've got a bit of an idea of what they're actually prescribing. And on the website, I've got some things, because you asked about handing things out, and we love as GPs. It's a great way to end a consultation, isn't it? It's like, how does the patient leave if they haven't been given something?
You've got to have something in the hand to deliver.
That's right.
Signal the end of the conversation.
Yeah, that whole signal, really. And so there are some resources that you can download from the Parkrun Practices website to print out. But another way is actually sitting with someone and signing them up.
That's good. I like that.
Yeah, so getting them to register, because they can just do it on their phone, or you can do it on your desktop, and then you can actually print out the barcode. Then they have something in their hand, and that's it. They only need one barcode ever, so counts as a prescription. I have been known to write it on care plans. Attend.
That's another good tip, actually.
Yeah. So it doesn't have to
be. Parkrun counts as a provider. Probably not. But
no, it doesn't. I don't think anyone's going to do anything with the paperwork if you start sending them TCAs. But yeah, I mean, I think just to attend, it doesn't have to be run. It could be, walk, spectate, volunteer.
One of the things I'd like to talk about in this show is challenges and principles. So we're going off on a little bit of a tangent here. Are there any challenges you've faced in relation to parkrun or in general practice that you've drawn some principles from that guide your daily practice? Any sort of strong principles that underlie what you do most days at work?
That is a huge question, isn't it?
I know. I've thrown you a curveball there.
Yeah. So yeah, look, as GPs, look, we know that our job is hard. I used to be I started off doing hospital medicine, and I was a medical reg, and sort of thinking about going to general practice, and someone's told me, oh, general practice is the hardest job in medicine. And I think to my shame, I might have scoffed slightly. It was a long time ago.
Well, you don't know till you're in it, do you? That's the thing.
No. And so then that transition from being a medical reg and having everything at your fingertips to being a GP on your own in a room when anything could walk in the door was a huge challenge. And I think, one of the things that I take away from it, I was very lucky. I had a great trainer, GP trainer. You have to embrace the complexity. And some days I really, really want to make things simple.
I think we all do sometimes.
And just have it protocolized or something, just try and make it simple. But I just think you have to embrace the complexity. And what helps me with that is staying curious. So I know that if I'm starting to get a bit tired or burnt out or something, sometimes the curiosity levels maybe will drop a bit. So stay curious, I think, is my motto for managing complexity.
So I think I have some of my better days when I come in and I have the expectation that things will be complex, because then you're not disappointed. I think staying curious is how I've often found or improved someone's healthcare the most, and it all takes time. You sometimes won't get the answer to your curiosity, but that is the great art of general practices. You get to see people again and again. So I love that. That's a beautiful challenge and principle. Thanks for sharing. In terms of Parkrun, if people want to find Parkrun, how do they find it? Is it just go to the website? Is there a social channel? What's the best way to get involved or join up?
Yes, so the website's got all the information there. So you can go on the Parkrun Australia website and you'll be able to find a map and find your local event. Most of the local events have got Facebook pages. That's the main social media thrust. Is still a bit of Facebook. They have got a presence on Instagram and other things, but the website is your first port of call. And for Parkrun practices, so for information about prescribing Parkrun or becoming a Parkrun practice, which is entirely voluntary, just runs on love and fresh air. That's the RACGP Parkrun practices website, which is a separate website.
Okay. And I did try to get to it at Wonka, but I know you guys did sort of a pop-up go to Parkrun, which I thought was a great initiative. I just couldn't work out how to get into the city with my running gear, and then I didn't know if I should go to the conference in my running gear afterwards. I'm sure I could have, but I love these pop-up initiatives you guys have.
Yeah, look, that was great. I just sort of gathered together 20 or 30 GPs and met some there. Some of us went on the light rail, and it was just fantastic to meet all these people from all over the country. And I went and had a park walk, a park chat. Some people, ran really, really fast, and we all had a great time. And I would love to do it at every conference. I would like all conferences to start at 9:30 on a Saturday morning to accommodate Parkrun.
I think that's a great idea, because obviously, we know the data. A lot of us as doctors don't look after ourselves, and Parkrun is equally as valid for any GP as for a patient. And I think it would be good to see that built into conferences. I remember doing one of the GP Student Network conferences back in the day, and the current chair at the time was an ex-military officer, and she got us out there doing push-ups and runs to get us ready for the conference. And that was a brilliant way to start, blood flowing, mind was working. So I'd very much support that. Do you guys get a lot of doctors coming down to run themselves?
Yeah, so I think a lot of GPs do go to Parkrun. So lots of, I know lots of physios, EPs, and various other healthcare professionals that are involved in Parkrun. And we've got this whole network now within Parkrun practices. So there are lots of people who are on board, both kind of as a prescriber and as a participant. And look, I agree. General practice is a pretty sedentary job. We all do with a bit of activity on a Saturday morning, and the social connection is pretty isolating as well. General practice.
It is. We're siloed, aren't we? Sometimes
on your own. The other thing that we've done at our practice before is a couple of times we've taken over all the volunteer roles at our local parkrun. And we're Black Butt doctors and our local parkrun is Black Butt Parkrun. So, it's it's quite nice. And just getting the whole team to go and do that together has been really fun. It's pretty easy to do. All the volunteer roles are easy. So that's another way you can get involved.
Okay. Well, I think we might wrap up soon because we're all busy. Is there anything you wanted to talk about or get into? Is there anything you wanted to spruik while you got me?
Just so on the parkrun thing, just remember that it's not all about the running. We love runners. I love running. Lots of us who talk about parkrun a lot are runners, but walking is great, and it doesn't have to be a stepping stone to running. So we know that the run in the name is a bit of a barrier. So we do want people to know that we also offer park walking and park volunteering.
Okay. I mean, I can't think of an immediate name you could change to. Park Ambulate certainly doesn't have the same snappy tone. But I'm sure if our listeners do want to suggest a name change, they can put that in the comments.
Yeah, I don't think it's going to happen. We're up to kind of, I think we're up to pretty much our 1 millionth finisher in Australia coming through early next year. The brand is pretty well established.
The brand's delivering. Why muck with it?
It's just going, it's parkrun, but not all about the running.
Okay. Well, that has been a brilliant chat about parkrun, social prescribing, complexity, and staying curious. It has been an absolute pleasure having you on, and I hope you have a pleasant day of consulting or day off, whatever suits.
Thanks, Chris. It's been great to be here. Thanks so much for having me.
Be an Awesome GP is targeted at general practitioners in the Australian context. It should not be taken as formal medical advice, and you should consult your own clinician for any medical matters. Opinions are those of the presenter or guests and do not necessarily represent any organisations.